I think we really need to be starting to kick into gear. It's great news that we're making some improvements in terms of diagnostic test kits and expanding access, but there are a lot of other, what might sound like boring policies and procedures kind of thing, but those things need to be done too.
Now, we've both been monitoring the situation for a number of months now, as I'm sure have our viewers, and there are still a couple of key pieces of information which seem uncertain to me. So the fatality rate being one, the fact that do we know yet exactly how long the incubation period is? Would you be able to clarify either of those two things?
Yeah, so on average, it seems like the incubation period is about 5 days, but there's a range, as with any other infectious disease. So it may be as short as 2 days for some people, as long as 14 days. So, there's a wide range. In terms of how the case fatality rate, how deadly this is, that does depend a little bit on where you are. So, for example, Iran, they're seeing case fatality rates that are much higher, as high as 16%. Now, part of that may be that they're counting the mild cases, so your denominator is actually much larger, bringing down that percentage. But it may also be a reflection of healthcare systems and the quality of infection control in those facilities. So we still think it's probably not higher than 2%, but only time will tell as we collect more complete and accurate information.
And when you talk about the discrepancies between health systems around the world, for example, between Iran and the United States, what type of supportive care would you be expecting to be administered to these people who are in the most critical condition that is left wanting in somewhere like Iran?
Well, when somebody has respiratory failure, so when their lungs fail and aren't breathing properly, not oxygenating properly, sometimes we do have to give them anything from just supplemental oxygen through the tubes that you see somebody have in their nose to actually being put on a ventilator. And there's a lot of things in between as well. And many countries have those things. The question is, how many do they have? And do they have the staff necessary to man them? And that's going to be highly variable from country to country.
The advice that's repeated most frequently at the moment is to wash your hands and to wash them frequently and very carefully. How long does the coronavirus live on surfaces like doors or public transport?
Well, with other coronaviruses, we've seen them able to survive out to 10 days on a surface. Again, that's highly dependent on humidity in the environment, temperature. So there's a wide range, again, with that, as there is with a lot of the other estimates we have with regard to this virus.
And I don't think we have that much time left, but as somebody who has been watching a lot of the media coverage of coronavirus so far, and perhaps looking at what people are saying online, are there any misconceptions that you think are very important to clear up, or any information that you'd like to see corrected out there?
I mean, I think the number one thing is this is real. Coronavirus is real. It is a real concern. It is not something to panic about, but it is something that we need to be preparing and, instituting the policies and procedures necessary to deal with the influx of patients we may well have.
Dr. Celine Gounder, thank you very much for your time today. We appreciate you joining the program.
My pleasure.